Type 1 versus Type 2 diabetes, understanding the key differences. Both types involve problems with blood sugar. Diabetes happens when your body cannot properly control the amount of sugar in your blood. Think of sugar as one type of fuel for your body. Just like a car needs gas to run, your body needs sugar for energy. But the body can convert most other types of foods into glucose or sugar. But when you have diabetes, something goes wrong with this process. Type 1 diabetes affects about 8% of all people with diabetes. Type 2 diabetes is much more common and affects about 90% of people with diabetes. When you eat most foods, your body breaks them down into sugar, or technically called glucose. This glucose, which is a type of sugar, goes into your blood. Then your pancreas, which is an organ in your belly, makes a hormone called insulin. Cells in our body make energy with this glucose. Insulin works like a key that opens the door to your cells, letting the sugar go inside to give you energy. I may use the term sugar to refer to glucose interchangeably. In type 1 diabetes, your immune system makes a big mistake. Your immune system is supposed to protect you from germs and diseases. But in type 1 diabetes, it attacks the cells in your pancreas that make insulin. Because of that, type 1 diabetes is called an autoimmune disease. Once these cells are destroyed, your pancreas cannot make insulin anymore. Without insulin, the sugar stays in your blood instead of going into your cells. Type 1 diabetes progresses very quickly to a stage where the person needs insulin injections. A drug called Teplizumab, Tzield, has been shown to delay the onset of type 1 diabetes in individuals at high risk. This medication is an immunotherapy that can potentially slow down the autoimmune attack on insulin-producing cells in the pancreas. While it doesn't prevent the disease entirely, it can delay the need for insulin therapy by a few years. But the cost of that drug is prohibitively expensive. Research shows that people with newly diagnosed type 1 diabetes still have about 52% of normal insulin production at first. But this drops quickly. After 2 years, they only have about 28% of their original insulin-making ability. Some people with type 1 diabetes may keep a small amount of insulin production for many years. But everyone with type 1 diabetes needs to take insulin shots to survive. Type 2 diabetes works differently. In type 2 diabetes, your pancreas can still make a reasonable amount of insulin. But your body becomes resistant to insulin, which means the insulin does not work as well as it should. Think of it like a lock that gets rusty. The key still fits, but it is harder to turn. Your pancreas tries to fix this problem by making more and more insulin. But over time, your pancreas gets tired and cannot keep up with the demand. Eventually, it may not make enough insulin to control your blood sugar. The symptoms of both types can look similar at first. People with either type might feel very thirsty and need to urinate more often. They might feel tired, hungry, or lose weight without trying. Their vision might become blurry. But there are some important differences in how these symptoms show up. Type 1 diabetes symptoms usually appear quickly, sometimes over just a few weeks. This is especially true in children and young adults. Type 2 diabetes symptoms develop much more slowly, sometimes over several years. Many people with type 2 diabetes do not even know they have it because the symptoms are so gradual. Age makes a big difference, too. Type 1 diabetes is most commonly diagnosed in children and young adults. The peak age for diagnosis is between 10 and 14 years old. But type 1 diabetes can happen at any age. Research shows that in Australia, about 13,200 children and young adults aged 0 to 19 were living with type 1 diabetes in 2021. Type 2 diabetes usually happens in adults, especially those over 45 years old. But we are seeing more children and teenagers getting type 2 diabetes now. In Australia, almost 1.2 million people were living with type 2 diabetes in 2021. That is about 4.6% of all Australians. In Sri Lanka, it is around 12.07%. The causes of these two types are also very different. Type 1 diabetes happens when your genes and something in your environment trigger your immune system to attack your pancreas. We do not know exactly what causes this to happen. But having a family member with type 1 diabetes does increase your risk. Type 2 diabetes has different risk factors. Being overweight, not getting enough exercise, and eating too much processed food can all increase your risk. Having high blood pressure, high cholesterol, or a family history of diabetes also makes you more likely to develop type 2 diabetes. Research shows that certain ethnic groups, including African Americans, Hispanic people, Native Americans, Asians, and Pacific Islanders, have higher rates of type 2 diabetes. Treatment for these two types is different, too. Everyone with type 1 diabetes must take insulin. There is no way around this because their pancreas cannot make insulin. But they can improve their insulin resistance and also select healthy foods which does not cause a steep blood sugar rise. They need to check their blood sugar levels several times a day and give themselves insulin shots or use an insulin pump. A cheap blood sugar measuring meter is a must if you have type 1. But get a reliable, reputable brand, as a wrong reading may lead to a wrong insulin dose and serious consequences. A cesarean section can also be associated with a slightly increased risk of their child developing type 1 diabetes later in life. A hygiene hypothesis suggests that reduced exposure to infections and a cleaner environment in early childhood may contribute to the development of type 1 diabetes by affecting the development and balance of the immune system. This idea proposes that early exposure to certain microbes helps train the immune system to distinguish between harmless and harmful entities, preventing it from mistakenly attacking the body's own insulin-producing cells. But type 2 diabetes treatment can be more flexible. Some people can control their type 2 diabetes just by changing what they eat and exercising more. Others need to take pills that help their body use insulin better. Some people with type 2 diabetes do eventually need insulin shots, but not everyone. Here is something important about preventing these conditions. There is no known way to prevent type 1 diabetes. It is not caused by eating too much sugar or not exercising enough. It just happens because of your genes and possibly some environmental trigger we do not understand yet. But, once you've got it, limiting sugary foods and plain carbohydrates may help. But you can often prevent type 2 diabetes. Eating a healthy diet with plenty of non-starchy vegetables, non-sweet fruits, and whole grains with less than 60% carbohydrates by dry weight helps. Getting regular exercise is also very important. Even losing just 10% of your body weight can make a big difference if you are overweight. Research shows that people who make these healthy changes can reduce their risk of developing type 2 diabetes significantly. Both types of diabetes can cause serious health problems if not treated properly. High blood sugar over time can damage your eyes, kidneys, nerves, and heart. Research shows that the most common complications in people with diabetes include sexual problems, which affect 12% of patients, heart failure affecting 4.2%, and kidney disease affecting 4.3%. But here is some good news. People with diabetes can live long, healthy lives if they take care of themselves. Research shows that people with type 2 diabetes who manage their weight, blood sugar, blood pressure, and cholesterol can increase their life expectancy by 3 years on average. Some people can gain as much as 10 years of life expectancy by meeting their treatment goals. The daily life of someone with type 1 diabetes involves more medical management. They need to count the carbohydrates in their food, check their blood sugar multiple times a day, and calculate how much insulin to take. But many people with type 1 diabetes live completely normal lives. They play sports, have careers, travel, and raise families. People with type 2 diabetes often have more flexibility in their daily routine. If they can control their blood sugar with diet and exercise, they might not need to check their blood sugar as often. But they still need regular checkups with their doctor and may need to take medication. Both conditions require ongoing medical care. People with diabetes should see their doctor at least twice a year. They need regular eye exams, foot checks, and blood tests to monitor their condition. The goal is to keep blood sugar levels as close to normal as possible while avoiding dangerous low blood sugar episodes. Understanding the difference between type 1 and type 2 diabetes is important for everyone. If you notice symptoms like increased thirst, frequent urination, or unexplained weight loss, see a doctor right away. Early diagnosis and treatment can prevent serious complications and help people with diabetes live healthy, active lives. The key thing to know is that both types are serious medical conditions that need proper treatment. But with the right care and lifestyle choices, people with either type of diabetes can live full, happy lives. The most important thing is working with your healthcare team to create a treatment plan that works for you. Do not forget to click the like button and subscribe. On the screen, you see an essential video for you. Thanks very much for watching this video. References are in the comments section. See you in the next video.